He is the University of Ottawa epidemiologist. And thank you again, Raywat, for joining us. As we look at the Manitoba numbers, the deaths shooting up to 18 again, really underscoring that those who get it that are in those vulnerable categories so often can succumb to the virus. And our case numbers, though, the new cases are slowly starting to go down. And this is something that you have said that it's going to take several more weeks, if not months, to get through. We'll have to get through this until we get enough people vaccinated.
Yeah, or until we find a way to diminish transmission significantly through economic restrictions or voluntary restrictions on our exposures. Remember, even though the number of new cases is diminishing, which is fantastic, it's going to take a while before we see that same decline in the hospitalization and death rates, because those are lagging indicators.
And as far as next steps are concerned here, when you look at Manitoba, and you see, the uptick in Quebec, the significant cases that we're seeing in Quebec, and now the lockdowns in Ontario. When I look to other provinces from Manitoba, I like the position that we're in, that we were criticized. Maybe we didn't lock down fast enough, but we certainly locked down a whole lot faster than other places in this country.
Yeah, look, it's easy to criticize in hindsight, but let's celebrate what we actually did do. So to the extent that you did anything, you should celebrate that. And going forward, that's all that matters, is what can we do to prevent further suffering now, rather than keep on, wishing we'd done something differently in the past. So now that we know what we need to do, let's keep on doing it.
Raywat, we've been asking this question of a lot of experts like yourself. How concerned are you about a surge after the Christmas holidays?
Oh, yeah, it's going to come. I mean, this is why we have these restrictions now in place in Ontario and Quebec, because the decision makers have finally realized that, yes, the more bad things are coming, and the ICU beds are going to be filled up pretty fast, especially in Ontario. So, yeah, I'm very concerned. It should come down again at the end of July and early February, end of January and early February, but that's not written in stone. And that's dependent, again, on people changing their behaviors as predicted. But yeah, we're going to have a really hard January, I think.
Raywat, when you look at our numbers here, as mentioned, we certainly don't want to diminish the good news. But one of the things that keeps sticking out to me anyway is that test positivity rate. That's still above 10%. In an ideal perfect world, where would you like to see that test positivity rate before we even consider loosening some restrictions?
The CDC's guidelines suggest that under 5% is when you can start to breathe more easily. And historically, and by historically we mean the last 9 months, not, longer than that, less than 3% is when we're a little more comfortable. Here in Ottawa, where I am, we have about 1.5% or so, and we're doing comparatively okay. So over 10%, way too high. When the pandemic first started and the first wave was diminishing, the CDC was talking about aiming for 1% before we started opening up things, and that was kind of too low for many American states to achieve. So a combination of low test positivity rate and low incidence rate and low ICU bed occupation is what we're looking for.
We're joined by Raywat Deonandan, a University of Ottawa epidemiologist. Raywat, let's go from, sometimes Manitoba feels like Antarctica, but the fascinating story emerging today, Antarctica was pretty much untouched by COVID-19, and now it's even made its way onto that continent somehow. That really goes to show just how transmissible this virus is among many viruses, frankly.
Oh, yeah, it's really an astonishing little story, isn't it? You would think they would be screening people a bit more thoroughly, or if they have, this disease is just insidious. It finds its way in. Despite military-grade filtering systems, really good ventilation systems, one assumes excellent cleaning procedures and mask wearing and distancing, this disease finds a way. Now, my biggest concern is Antarctica is not known for its high-quality quaternary care, medical care systems. So I hope that the people who have been infected have been evacuated. Anyone showing symptoms have also been evacuated, because it's a bad place to have a really bad episode of COVID.
This really goes to show that, and like you mentioned, even if you have the best restrictions and the best equipment available, this virus is just that insidious that even with the best things available, inevitably at some point it'll find its way, because our testing and our equipment may be 99.9% effective, but it's still got that tiny little window, and that's really all this virus needs.
This is something that a lot of people don't understand. They hear about people like Emmanuel Macron getting infected despite famously wearing a mask everywhere, and they ask, why is that possible? I thought the mask is supposed to protect us. No, nothing is perfectly effective, and what we're hoping for is several layers of protective interventions: mask wearing, distancing, frequent testing, all that good stuff, so that the various failures of each of those endeavors is accounted for. So you have to have all of them in place, and even so, you're not 100% protected. Probably going forward, the best thing we can do is just have frequent testing to make sure that we do not introduce infection into previously pristine places like Antarctica.
And kind of sticking with the theme of the virus showing up, well, pretty much everywhere, we have this new strain out of the UK that's causing some concern. I've heard and read things online, Raywat, from various experts who say, with the travel restrictions and the lockdowns in place, we can contain this new strain that apparently is easier to transmit. From your perspective, do we have a chance at containing this, or is it already too little, too late once we've detected it?
We have a chance of slowing it down. It's probably impossible to contain it entirely. It's probably already in multiple countries. Maybe it's already in Canada. We don't know. It's definitely left the UK. What we care about now is three things, really. Does it really infect people more readily? That's not a done deal. Is it more or less lethal? It's probably exactly the same lethality. And does it affect our immune system differently? Meaning, will the vaccine still work? So far, it looks like the vaccines will still work. So as long as those three questions are being answered by our experts, I think we've got a good chance of handling this.
When will we know?
In 2 weeks. I mean, the makers of the vaccines, this is their biggest thing right now, is establishing whether or not the new mutation can be addressed by the vaccine. They'll know pretty soon. And in terms of, is it more infectious? Well, that's an epidemiological question. We'll need more data for that, probably several weeks. Is it more lethal? We'll know again in 2 weeks when those areas that are mostly beset with this new strain start showing their hospitalization and death rates. Now, it's possible that lethality will be conferred not from the virus itself necessarily, but the kinds of populations it leaks into. So let me explain that. It may be that if you get the virus, the new strain, you're just as likely to die. But because it's possibly more infectious, it's more easily introduced into vulnerable communities who are more likely to die. So that might give us a false signal of greater lethality. So we have to be on the lookout for these subtle signals.
So do travel bans work then?
Yeah, I think they do. They definitely work in slowing the spread. Now, what we don't want is to give the virus more opportunity for a mutation so that it actually does become resistant to the vaccines. And the way you give it opportunities for mutation is allow it to infect more people. So it's more important than ever before to slow transmission. That means what we have to do as individuals has not changed. Distance, mask wearing, etc., to not allow the virus an opportunity for mutation. Right? Now, it's possible, too, for it eventually to mutate into something better. It can mutate into something that actually responds to vaccines better. We never know. But just not roll that dice. Right? Let's limit the opportunities for mutation.
So I guess, Raywat, the big takeaway from this new strain of COVID-19 is, keep wearing your personal protective equipment, keep up the physical distancing, and at the end of the day, we will have a much better idea in a matter of weeks, which, I'm sure for people like you, Raywat, obviously the science needs to be followed, but that just seems like an agonizingly long time, especially when there are lives on the line.
It does. Now, it really does not affect anyone's life that much right now because, as you said, it doesn't change what we have to do. Frankly, epidemiologically speaking, my biggest concern is if indeed it is more infectious, that means a higher limit for herd immunity. It means instead of 70% immunity, we need to get like 75 or possibly 80% of people immunized. That just makes our job a bit harder as public health people. Other than that, there isn't anything much to worry about for the common citizen. So let's not panic about this just yet.
Raywat Deonandan, always appreciate your insight. Thank you so much.
Thank you.